this latest Global Cities video series, I'm here with Jonathan Murphy, CEO of Assura, where he's been since 2013, and he's been CEO since 2017. Hi, Jonathan.
Hi.
So, Jonathan, has anyone been at Assura longer than you?
Yeah, there are. Yeah, we've been going 20 years. So,
Okay.
in fact, we've got our 20th anniversary coming up in a few weeks' time. And there are a handful of employees who've been with us since the start. But yes, I'm definitely one of the longer serving members of the team.
Big party coming up,
Yeah.
though. Sounds good.
Yeah.
Cool. So, as you know, sort of relatively quick fire questions,
Great,
and we'll just sort of run through them just to understand a bit more about your business.
Sure.
So, could you just summarize your business for us?
Yeah, so sure. We're a healthcare business, so we invest in GP surgeries and medical centres. So basically, if you think about anything that's a community healthcare asset, then that's the type of thing that we're involved with. Typically, a GP surgery could be a dialysis centre, maybe even a diagnostic centre, that sort of building. So it's all about providing infrastructure, and essentially, it's for the NHS. That's 90% of our business is working for the NHS, and it's all about long-term trends. You know, supporting that demand for healthcare out of hospital. That's the core part of what we do. And we buy, we develop, and then we manage. So we do the whole sort of spectrum in terms of looking after the assets.
Yeah. And so I guess my next question was going to be, where does the demand come from? I guess it's just sick people, basically.
Yeah.
Isn't it?
So it's ever growing. I think, unfortunately, obviously at the moment there's a real pressure in the system. So you've got getting on close to 8 million people now waiting for operations. Now clearly they don't have an operation in a GP surgery, but that pressure in the system is just as real for GPs as it is in hospitals. So the demand is huge. There's an ever increasing demand. We're trying to do more out of hospital, so that increases demand. We've got more people, got more aging population, people living older and longer. So that obviously increases demand. And then we also have I'm afraid to say, a really poor quality estate in general across the UK. So a lot of our buildings are old Victorian terraced houses that need replacing. So the demand's really, really heavy.
Yeah, I imagine there's probably no one in the UK who doesn't understand the greater need for improved GP surgery.
Yes, well, a lot of people are having to go to very poor quality stock at the moment. Absolutely.
Yeah, easy to understand, which is what we always like. In terms of sort of the jewel in the crown, what do you see as the most valuable part of your business?
Yes, I mean, obviously, clearly, real estate investment business, often you would have one scheme or one development. That's not really how it works for us. We've got 620 assets right across the UK. They're almost all equally valuable, if that makes sense. The underlying occupier is the government paying the rent, so the covenant is exactly the same. So the real strength in our business is the expertise we have around development, because we design and build ourselves, and our growing expertise around sustainability. I'd probably highlight those two things as the sort of core parts of the business.
Yeah, I mean, certainly when we started looking at the business, the initial things are, that demand ever growing, government-backed, kind of quasi-government-backed income stream, really, really interesting. And then in terms of recreating the portfolio, so obviously everyone knows aging demographic, need for GP surgeries. How hard is it for someone to try and recreate your portfolio?
Oh, it's incredibly hard. So the barriers to entry are really high. And the reason for that is very granular. So I said it's 620. So that's a lot of small assets right around the country. So you've got to have local knowledge. You've got to have relationships in those localities. You've got to know, if you want to buy a GP surgery in Blackpool, you need to know about all the medical centres in Blackpool and where yours sits on that map. And frankly, that's very hard for people to do. If you take an example, BlackRock are a big investor in the space. They own about £300 million worth of stock. For years, they've been looking to expand that portfolio significantly, and they incrementally make the odd acquisition, but they can't really move it on at the rate we can, because I've got a team of 40 people who are out and about meeting doctors all the time, and we're plugged into the system. So it's really hard to replicate.
Yeah. Okay. And then from a business perspective, what excites you most as you think about the next 5 years for Assura?
Yeah, well, I mean, it's a tricky one, this, really, because what excites me is the opportunity, but of course the flip side of the opportunity is that there's a lot of pressure in the system. So you almost feel a bit guilty about being excited about it, because we've got health problems and we've got pressures and people waiting for operations. But there's a massive demand in the UK for improved out-of-hospital space, and we can make a real difference with the building. So I think the thing that would excite me the most is the opportunity to deliver modern, best-in-class buildings that can really transform the lives for the occupiers, the workforce there, but also obviously improving patients' outcomes as well. So the opportunity there is the exciting thing, though, as I say, you feel almost guilty being excited about it, because it means that there's increasing problems in the health system. Yeah.
No, I won't think worse of you.
Okay.
And then from a sustainability point of view, what is sort of the biggest issue you face or opportunity for the business?
Well, clearly sustainability for anyone in the built environment is massive. There's a lot, as you know, lots of technical challenges. I mean, I think this building is an exemplar building, is it, in terms of the fabric. So the developer here did an amazing job in terms of designing and delivering the fabric of the building. We're trying to do the same. So we're looking at ways we can reduce the carbon in our buildings, trying to really push that as far as we can. We have a net zero design guide that we've published. So every new building we deliver, we aspire to meet the net zero guidelines, the 2030 guidelines. So we're really trying to push that as hard as we can. So there's a challenge around technical skills and how you do that, and we're learning on the job, as it were. But probably the biggest challenge, and I think this is common for all sectors, is the customer. So the customer is the NHS. They like the idea, they don't like the idea of paying for it. So that's the big challenge, and I think that's the same in any sector, isn't it? So it's going to cost net zero, and ultimately, we're going to have to persuade the customer to pay in the end. But at the moment, that's a challenging conversation. But I think that's the same in retail, office, industrial, I think. So.
Exactly. I don't think you're an exception there. Right, now for some slightly different questions.
Okay.
So who's the most famous person you've met?
Most famous person I've met, Sir Alex Ferguson, does that count?
I think that definitely counts. That's a good one. And then who wins a fight between a lion and a tiger?
Oh, gosh. Tiger.
Tiger, very good. Do you prefer cheese or chocolate?
Cheese.
Cheese. And then which is your favourite city?
Favourite city? I'm going to say Manchester.
Manchester, there you go. Consistent theme there. Thank you very much for joining us.
Well, thank you
for everyone for listening in today to the Global Cities series, and see you next time.